Hi, this is Dr. Scott Niblo, Norfolk Chiropractic Center. Another really common thing that we see, or hear rather, every single day is a patient that presents and tells the staff in the history obtaining, I think I slipped a disc. There is no such thing as slipping a disc. A disc cannot slip. It can do a lot of different things. As a matter of fact, there's over 100 forms of disc deviations. Bulges, herniations, sequestrations, fragmentations, on and on and on. There are many, many, many forms of pathology or damage to a disc, but slipping is not one of them. Now, they present with different symptoms. People think they have, or they hear the term disc bulge and they immediately need a neurosurgeon or a orthopedic consult. Oh my gosh, I need epidurals in my back and so forth. 90%, study-wise, 90% of disc problems just need conservative care. Less than 5% need surgical intervention. Very, very, very infrequent is this a reality for people. But unfortunately, you know, the reality is they think that when they hear that as a diagnosis, this is what I need. So a lot of consultations. I certainly have enough orthopedic and neurosurgeon friends. A lot of consultations that are just that. Yes, you have a disc issue, but this is not a surgical consultation or something that would require surgery. You just need some form of therapy. And guess what? To return function. Calm the disc down and make your spine functional again. And the same thing holds true, again, with any diagnosis with the structure. A disc bulge being, you know, probably one of the most common, if not the most common thing that comes through our doors, is if you do not get full range of motion back into your spine because of a disc bulge, in other words, the disc is not centralized or treated efficiently enough to make the disc work for you well again, you will continue to flare and be very, very frustrated with your situation, thinking that you need something else, which you may. However, if function is never returned, you will never really get over the amount of flares. If function is fully returned, you should, by definition, have regained function to that disc. I can't tell you how many times over the years that I've treated someone for disc bulges, herniations, treat them successfully, they're released from care, they show back up 3-4 years later with something new, unrelated, get an MRI of that area, and the radiologist will always compare one MRI to another, and many, many, many times, if not almost every time, previous notation of L5 disc herniation now resolved. So the disc will heal itself just like the rest of our body, given the opportunity to do so. It will shrink in size, it will repair itself if it is treated effectively. But it typically will not do so on your own. These are things that need, unfortunately, they need treatment. You can't just, hang out on an inversion table and expect this thing to be resolved all by itself. You kind of need, guidance. You got to have your neurological integrity looked at. Is this a safe thing to do? Conservative care? Do I need additional care in conjunction with? Do I need to be evaluated right now because you have weakness for possible surgical consult? These are things that we do all the time that people are not expected to know and do know themselves, and that's why you see someone who kind of knows what they're doing with these things, so it's managed efficiently for you, and hopefully the outcome that you want is obtained. But it usually requires treatment to do that.